Welcome back, aspiring medical coders, to Part 97 of our 100-part CPC exam series. Today, we're diving into a high-energy masterclass on healthcare compliance rules. We're talking about the critical shields that protect your practice, your patients, and honestly, your entire career. So let's get right to it.
Before we jump in, make sure to like, share, and subscribe to Decode Healthcare with Harshal. Seriously, do it right now, because mastering this exact regulatory criteria makes up about 3 to 4% of your entire CPC exam. It sounds small, but trust me, knowing these rules is the absolute difference between a clean claim and a frankly devastating compliance audit. Here's our syllabus for today's explainer. We're going to systematically break down 4 crucial areas: the privacy shield, the financial shield, the organizational shield, and finally, the audit enforcers. Let's go! Section 1, Compliance and Privacy Overview. Let's look at the big picture of regulatory compliance and why it's tested so heavily. Moving right along to Section 2, HIPAA Privacy and Security Rules. Think of this as your ultimate privacy shield, governed by the Health Insurance Portability and Accountability Act. Now, there's a very clear line drawn in the sand here for the exam. HIPAA rules apply strictly to covered entities. These are the folks actually providing care, like hospitals or clinics. But it also extends to their business associates. These are the third parties handling data for the providers, like a billing company or an IT vendor. Both are completely on the hook for compliance. And guys, a single HIPAA violation can literally cost a practice anywhere from $100,000 to over $60,000 per incident. So yeah, they enforce this stuff. The core asset we're protecting here is Protected Health Information, or PHI. And this applies whether it's written on paper, spoken out loud, or stored on a computer. The absolute golden rule you need to memorize is the minimum necessary rule. You must always limit PHI disclosures to the absolute minimum needed to get the job done. Basically, no casual chart snooping allowed. When it comes to keeping that electronic data safe, the HIPAA security rule relies on 3 specific safeguards. First, you've got administrative safeguards, which are basically your policies and training. Then, physical safeguards, literally locking the doors and controlling facility access. And finally, technical safeguards, which means things like strict access controls and data encryption. All right, Section 3, Advanced Beneficiary Notice, or ABN. We're transitioning from data privacy over to financial compliance. So, what is an ABN? Officially, it's Form CMS R-131, and it's a mandatory written notice issued to a Medicare fee-for-service patient. The absolute kicker here is the timing. It must be presented before rendering an item or service that you fully expect Medicare to deny because it's not considered reasonable and necessary. To avoid those tricky exam traps, let's unpack the valid execution rules. Simply handing over a blank form doesn't cut it. The ABN has to state the exact reason why you expect a denial. It needs the estimated cost. The patient actually has to select an option. And critically, they have to sign it prior to the service delivery. Here's the massive financial liability shift you need to know. If you have a perfectly valid ABN, financial liability transfers directly to the patient. But if that ABN is invalid or missing altogether, the healthcare provider eats the cost. That means mandatory write-offs for the practice, and nobody wants that. Next up, Section 4, the OIG 7 Compliance Elements. This forms our organizational shield, built straight from the Office of Inspector General's guidance. The OIG really wants to stop problems before claims ever go out. You can memorize their 7 core elements of an effective compliance program with this simple sequence: policy, people, training, talk, test, consequences, and fix. That means having written policies, a dedicated compliance officer, solid training, open lines of communication, internal auditing, clear disciplinary guidelines, and actually taking corrective action when things go wrong. Which brings us to Section 5, Medical Audits and Contractors. Let's see how well our shields hold up against the enforcers. You've got to understand this clear binary for the test. Prospective audits happen before the claim is billed. They act as a preventative measure to catch errors early. Retrospective audits, on the other hand, happen post-payment. These are the ones looking to recoup improper funds, usually using random or targeted sampling to find patterns where you slipped up. You are definitely going to see this acronym soup on the exam, so know the players. You've got external audit entities like RACs, which are Recovery Audit Contractors. Then CERTs for error rate testing, UPICs for program integrity, and of course your local MACs, the Medicare Administrative Contractors who handle local coverage rules and initial claim denials. Finally, Section 6, Summary, and Part 98 Teaser. Let's lock all this in with a quick review. Go ahead and take a screenshot of this one-page visual summary cheat sheet right now. It's packed with the highest yield compliance facts you'll need to memorize. Just remember the minimum necessary rule for HIPAA, remember that an ABN only shifts financial liability if it's signed pre-service, nail down that OIG 7-step sequence, and know the difference between prospective and retrospective audits.
Get ready to actually apply all these rules in our next explainer, Part 98, where we'll be diving into a CPC exam practice masterclass. We're going to break down some intense compliance and NCCI modifier case studies. So, as you study your notes tonight, I want to leave you with this thought. When the auditors inevitably come knocking, is your documentation truly rock solid enough to defend your claims? Think about it. I'll see you in the next one.